Hello everybody, we're going to talk about the blockchain for healthcare. This is going to be a series of short presentations which are going to discuss how blockchain technology can be used to change and improve the management of data within the healthcare system. We've heard a lot about blockchain in recent years, usually in the context of cryptocurrencies such as Bitcoin, but this technology has applications outside of cryptocurrency. Blockchain is a way of storing and sharing data in a way that can be distributed, transparent, and tamper-resistant. So what is a blockchain? Well, a blockchain is a chain of blocks that has a start and a free end to which new data is added. This gives the blockchain a direction. Each block consists of data in an easy-to-manage size that's linked together with a cryptographic pointer. This link ensures the integrity and tamper resistance of the blockchain. When you add new data to the blockchain, you first create your data packet, and then you link it to the free end of the blockchain, extending the blockchain by one block or unit. As you add more and more data to the blockchain, the chain gets longer and longer, and this will grow to whatever size is needed to accommodate the data that you are collecting. This can be done in real time, or it could be done in a delayed format until the blocks reach a certain size. The features of the cryptographic links help ensure tamper resistance and data integrity. So if you modify one of the blocks in your chain, this will break the cryptographic links, disrupting your blockchain. New data can be added to the chain, but a user will be able to detect that this data is different than what was originally present on the chain, allowing you to verify the integrity of the data that you are reviewing. It's not just the features of tamper resistance and data integrity that make blockchain attractive. You can copy the blockchain to multiple other locations. Those could be within the same facility or healthcare delivery network, or it could be part of a national or international data sharing program to make your healthcare data available to researchers or other facilities, insurance providers, in multiple locations. These blockchains are linked within a network which shares data and assures that the data within the network is accurate, reliable, and consistent. So when you add data to the blockchain at one location, it is then distributed to one or more locations within the network. Those new locations then also share the data within the blockchain network, eventually distributing the new data to the entire network. This gives every location access to that new data. It provides redundancy to the new data. So that's what blockchain is. The big question is how can this technology be used for healthcare delivery? Anyone who works in healthcare realizes that healthcare generates an enormous amount of data. Laboratory tests, imaging studies such as X-rays or CAT scans, other measurements such as vital signs, reports, financial documents, and the list seems to be endless. The volume of data being generated in healthcare is expanding at a very rapid rate. However, healthcare data currently suffers from challenges of access to that data. How can that data be accessed outside of the healthcare delivery facility in which it is stored. Blockchain has the potential to improve that. How can you verify the integrity of this data? Has it been altered or tampered with? Has it been damaged due to a database error? Blockchain has the potential to ensure the integrity and redundancy of this data, and blockchain helps with the distribution of this data within a network of facilities that use the data. These features have the potential to impact the cost, quality, and value of healthcare delivered within a system using blockchain. The remainder of these presentations will focus on how blockchain technology has the potential to impact the cost, quality, and value of healthcare delivery. Thank you for listening, and I hope to see you in the remaining presentations in this series. Hello everybody. Today we're going to talk about blockchain and the cost of healthcare. One of the big factors in healthcare today is that we need to manage a large amount of data, and this data impacts the cost, quality, and value of the healthcare that is delivered. We're going to focus on the cost of healthcare and how this can be impacted by improved data management, particularly in the context of blockchain. And it's important to remember that this does not have to be a single blockchain, but this can be multiple blockchains, either regionally or widely separated, sharing information throughout the entire system. One major factor for healthcare costs are administrative expenses. It's thought that 25% of every healthcare dollar is spent on administration alone. These administrative costs are in a few major domains: costs that relate to revenue, costs that relate to regulation, and the costs of reporting. With revenue, you have to deal with things such as payment authorization, tracking payments, accounting. For regulation, you have to manage data related to compliance, enforcement, and review of local policies and procedures to make sure that they are in compliance with regulation. You also have to generate reports on all of these factors and other things such as healthcare quality, the performance of individual healthcare providers or elements within your healthcare system, and the financial performance of the healthcare system. Blockchain can really help with this because it can make many of these tasks automated, verifiable, immutable, and decentralized, so you don't have to have a central compliance staff that's very large, employing multiple employees throughout your healthcare facility, let alone throughout a healthcare system. There can be a small number of employees focusing on making sure that the automated, verifiable, immutable, and decentralized blockchain-based system is working properly. And also providing training for the people that work within the system. And under the same terms, the revenue generation system. Authorization for a procedure can be verified in an automated way and also a decentralized way to know that your facility is going to be paid for healthcare services delivered. It can also track the payment for those services and make sure they're delivered in a timely fashion and in the amount that was authorized, and then to run appropriate accounting reports for your facility. Simplifying all these factors would result in enormous cost savings within the healthcare industry. The costs that are consumed by the current administrative overhead could then be redeployed to improve other operational efficiencies, expand services, and possibly even expand access to healthcare services. Another major factor within healthcare is duplicated effort. You would think in the era of electronic health records that this would be a rarity, but unfortunately it is not. A review of a major healthcare system revealed that about 15% of the identities within the electronic health record were duplicates. That can lead to confusion over which record is being edited, which record should test results be added to, and if a provider is only looking at one of 2 or even 3 records for a single individual, will they miss something because of the complexity of the system? A system like blockchain would dramatically reduce the presence of duplicate records within the electronic health record system. When you look at specific forms of duplication, if you look at imaging studies, about 25% of all imaging studies, which are x-rays, ultrasounds, CAT scans, MRIs, and similar studies, are a duplicate of a test that has been recently performed on the patient. This duplicate is ordered because the original test results, let alone images, may not be accessible to the healthcare providers that are needing to make decisions about patient management at that time. Eliminating this waste could dramatically improve the efficiency of healthcare, customer satisfaction, and reduce healthcare costs. When you look at laboratory results, about a third of laboratory results are also duplicates of tests that have been recently performed. Again, it's the problem if the test is performed at another location that does not share the same electronic health record, those results may be invisible to the healthcare providers treating the patient at that moment. Yes, there are means to request it, but under current regulations, it may take days for those results to be transmitted to your facility. And if you need to make a decision within minutes, you're going to have to order the tests to be performed at your facility so you can have access to those results to assist in the management of your patient. This duplication represents an enormous amount of waste. Many millions of dollars are spent on unnecessary duplicate tests, and this puts a large burden on healthcare systems. It results in additional charges to patients and their insurance companies, and requires that excess capacity be built into the healthcare system to allow for appropriate throughput of patients needing duplicate tests. By reducing the amount of duplication, testing could be more efficient, easier to schedule, and more flexible, which would result in improvements in patient satisfaction and would expand the availability of the testing technology to a larger pool of individuals. In addition to the waste, this duplication also creates risk. Some tests, such as a CAT scan with intravenous contrast, or an MRI with contrast, or a biopsy, meaning a surgical procedure to remove a piece of a tissue that's under study, are not without risks. These risks can range from a mild allergic reaction to a life-threatening allergic reaction, or even a complication that could result in the death of an individual. The other factor of risk is that unknown data exists about your patient that may tell you in one set of reports that you do not have access to that a procedure or treatment is not indicated, or that one is urgently indicated, but because that data is invisible to you, you are not able to use that to make a decision on how best to treat your patient. So eliminating this duplication would reduce several types of risk to individual patients within the healthcare system and medical legal risk to the healthcare delivery system and the providers working in that system. Let's take an example. You have a patient who seeks medical treatment at a hospital. They come in with a common problem such as chest pain. They're evaluated in the emergency department, and they have the necessary and appropriate tests ordered to start working up their chest pain. The patient does mention they have a primary care doctor, but because they're not within the same healthcare system, you access a second electronic health record to get the records from that patient's primary care provider. You get some testing data, and you find mention that the patient went to a prompt care clinic a few weeks ago for chest pain as well. You then log into a third healthcare record and get the records from the prompt care provider. In reviewing this information, you have a better picture of the past medical history and prior treatment and investigations that your patient has had. But is this a complete picture? You have no way of knowing unless the patient tells you. After careful review of the prompt care notes, you find that the patient was referred to a specialist physician in another town. You know that person's name and what specialty they are, but because they're not within your local community, you don't have access to the healthcare records. You then send a request to that clinic, but because it's a weekend, it's going to be several days before that information even gets to a person to see if they could provide that to you. This may actually be more complex. The patient may have information elsewhere. If you had a centralized registry of at least where all the data was for your patient, it would allow you to more efficiently obtain a broader picture of the overall health of your patient. In this situation, if we did have a blockchain registry of where the patient's data is, perhaps even what the data is, you would find out that the patient was seen in yet another clinic, another prompt care setting, and also received treatment for the same condition in another hospital. If you had all of this information readily accessible, you would have a better picture of the overall health of your patient, what previous treatments and investigations had been performed, which might help you reduce duplication, might help you avoid avenues of investigation that were not fruitful in the past, and provide more timely, efficient, cost-effective, and patient-centered healthcare. And that is how blockchain has the potential to dramatically impact the cost of healthcare delivery. Back to our fundamental problem. In healthcare, it's the management of data and how the data can be made verifiable, immutable, distributed because of the use of blockchain technology, which can be used to provide automated, data-based services. It can aggregate data and secure the data. I hope you found this presentation interesting. We look forward to seeing you in our next presentation. Thank you. Hello everybody, we're going to talk about the blockchain and healthcare quality, or how we can use the blockchain technology to improve our data management in healthcare, which can also reduce the cost, improve the quality, and improve the value of healthcare services delivered. With this presentation, we're going to focus on healthcare quality. So, applying blockchain to healthcare data can result in automated data collection and verification processes, verifiable data, aggregated data from multiple sources, immutable data that's tamper resistant, secure data, which has reduced vulnerability to cybercrime, and also distributed data, which can give redundancy and fault tolerance to the system. All of these features are potentially very valuable in the healthcare environment. We're going to focus on how this might impact healthcare quality. Well, what is healthcare quality? That's a really good question. Healthcare quality is defined by the Institute of Medicine to be the degree in which healthcare services for individuals and populations increase the likelihood of desired healthcare outcomes and are consistent with current professional knowledge. This factor of being consistent with current professional knowledge means that healthcare quality is an evolving process that can change as new research becomes available or as new standards for healthcare quality are developed. So the first part of evaluating the quality of healthcare is to measure that. And you measure that by comparing what you observe in your population to target metrics that are defined to be measures of healthcare quality. You will then report on how closely your measures meet the target metrics. You will then devise strategies to improve healthcare quality and therefore improve the measures of healthcare quality within your population. You also need to document that you comply with required measures of healthcare quality and that you are eligible to receive the awards, usually in terms of financial rewards, for providing the highest quality healthcare for the patients that you serve. All of this relies on data. Some of the features of blockchain, such as being aggregated, being verifiable, potentially being automated, distributed, maybe not so much so useful for this. Being secure, again, maybe not very useful for this specific task. And the fact that the data is immutable may or may not be valuable in the process of evaluating and improving healthcare quality. But these features clearly are important factors for effective data collection and delivery with the aim of improving healthcare quality. If you look at the Six Sigma DMAIC cycle, where you define a problem or an objective, you measure how well you comply with that objective, analyze the process that produces the outcome, develop a means to improve that outcome and control for variability within the system, is very familiar to people who engage in quality improvement work. Also, you may have heard of the PDSA cycle, where you plan, do, study, and act on quality data collected within your organization. To use either of these two methodologies, about 80% of the quality improvement team's time is spent collecting data instead of analyzing the data or implementing plans to improve healthcare quality. This seems very inefficient. The use of blockchain for data collection and management for quality in healthcare could dramatically reduce the amount of time spent collecting data, allowing these very valuable employees in your system to focus on actually improving quality. So, reporting and measuring are very straightforward with blockchain, and then you can use that information that you have reported and measured to improve and assure compliance with relevant quality metrics and to assure that your healthcare system receives the appropriate reward for high quality care delivery. Because the characteristics of blockchain, healthcare data can have properties which make it very amenable to quality improvement tasks such as verifiability, aggregation, being immutable, automated, and also distributed and secure. So that is how blockchain and the implementation of blockchain for healthcare data can be used to improve the quality of healthcare delivery. I want to thank you for listening to this presentation, and I look forward to seeing you in the next presentation. Hello everybody, we're going to talk about the blockchain and healthcare value. The big question is how can you use this blockchain technology to improve the value of healthcare? What does a chain of blocks of data linked cryptographically have to do with healthcare quality at all? One thing to remember is that healthcare runs on data, and the data, its cost, distribution, maintenance, and accessibility has significant impacts on the cost and quality of the healthcare, and these two factors impact the value of the healthcare delivered. So when you take your data and deploy it in a blockchain-based system, this helps make your data verifiable, immutable, and distributed. You can also leverage additional technologies applied to the blockchain system to make it automated, aggregated, and secure. These factors are very attractive for healthcare data or any mission-critical data for any industry. But what does this really have to do with healthcare quality? The first thing that you need to understand is what healthcare value is. And I'll start off by admitting that it's very difficult to define what healthcare value is. One definition is that healthcare value is defined by the Healthcare Leadership Council as the quality of care provided divided by the total cost of that care. So what does blockchain have to do with this? Well, if blockchain can improve any process related to the management and life cycle of data within the system, it has the potential to impact the quality or the cost of healthcare, and these impacts may result in increased or decreased value. So any change that improves the quality of healthcare or reduces the cost will result in improved healthcare value. So reduced cost leads to increased value. And when you think of the administrative costs, 25% of all healthcare revenue is consumed by administrative costs. So anything that you can do with blockchain to improve the revenue cycle, such as automated authorization, verifiable payments, immutable and decentralized accounting, improved regulatory compliance and enforcement, and improved quality reporting, performance reporting, and financial reporting. All of those could result in substantial improvements in the cost of healthcare, allowing the same or better quality healthcare to be delivered at a reduced cost, and therefore at an increased value. Increasing quality also leads to increased value. So being able to accurately and rapidly measure healthcare quality metrics, being able to report those quality metrics, possibly compare them to other facilities within your system or other facilities nationwide or to national benchmarks, using that data to drive quality improvement efforts in the local system, using the data to ensure compliance with required quality measures. This is also an area where automation could play an important role, and also making sure that those quality measures are met, and that is used to drive reimbursement from newer performance-based healthcare reimbursement systems that are in development. If you also look at the time of quality improvement teams, about 80% of their time is spent collecting data. By reducing this through the use of aggregated and automated processes through blockchain, would allow your quality improvement team to spend time improving quality instead of collecting data. So by storing your data on the blockchain makes your data verifiable, immutable, distributed, and gives you the opportunity to leverage other technologies to make processes automated, aggregate data from multiple sources, and to secure your data. All of these factors can improve the value of healthcare within your system. And that's how blockchain can impact the value of healthcare. I'd like to thank you for listening to this presentation. I look forward to seeing you in the next presentation. Hello everybody, we're going to talk about barriers to the use of blockchain in healthcare. We've talked a lot about blockchain, about its properties and how it might be applied to the healthcare industry, particularly in the context of managing data and how that might impact the cost, quality, and value of healthcare delivery. Blockchain is a fundamental data technology, will be expensive to implement. Legacy systems will have to be adapted or replaced to work with blockchain. New hardware will have to be deployed to manage the blockchain network, particularly if this involves mining, as is seen in cryptocurrency. There may be substantial energy costs associated with this, but those issues will have to be addressed. Also, the question is, what is the reach or scope of a blockchain network for healthcare? Is it going to be in a single healthcare facility? Is it going to be a system-wide deployment of blockchain, possibly involving dozens of hospitals? Or is this going to be a nationwide or international deployment of blockchain? Defining the reach and scope of a blockchain deployment is really important because you have to comply with multiple jurisdictions, laws, and regulations related to healthcare data transmission and storage. There will also be substantial administrative costs to administer the blockchain that is likely to be less than the current costs to manage the information technology infrastructure of the healthcare system today, but those will also have to be paid for. Additionally, there may be technological barriers, making sure there is sufficient broadband internet connectivity to allow a blockchain node to function in every clinic and in every hospital, and also to make sure that the blockchain network is robust and fault tolerant. There may be legal hurdles that have to be met to make sure that the blockchain deployment complies with applicable laws and regulations. Of particular interest is a law called HIPAA, which we're going to discuss in more detail. HIPAA is the Health Insurance Portability and Accountability Act of 1996. This was signed into law by President Bill Clinton. This has an important rule called the Privacy Rule, which defines circumstances in which healthcare information can be shared, who it can be shared with, and what documentation of the sharing must exist. Within this privacy rule, there is a creation of an entity called protected health information. This is identifiable health information such as an individual's name, birth date, address, social security number, and a host of other pieces of information. Sharing anything with protected health information or storing protected health information has to be done in accordance with HIPAA regulation. Under HIPAA, individuals have the right to access their own information upon request. They also have the right to correct inaccurate information. This may be problematic in a blockchain database because, as we discussed, you cannot modify or alter an existing block of data. What you'd have to do is append a new block of data with appropriate logic built into the system to tell you to disregard the old incorrect block of data. You also have the right to know who accessed your protected health information. So if you go to if you've been in a hospital, you can go to the hospital and you can request a list of the names of every person who accessed your information. Many people are shocked when they get this because the list often has hundreds of individuals, because it's everyone from the billing department, coding department, even food service access your protected health information to find out where you are, to deliver your meal to you, to come see you, draw a lab test, and report those results. This may be challenging in the setting of a blockchain database, but it is a technological hurdle that will have to be addressed before blockchain can be used to store protected health information. There are also mandatory training requirements which must be repeated every year for anyone with potential access to data. Delivering this training, documenting compliance with the training, and enforcing the rules and regulations are significant challenges in healthcare environments, and literally everyone needs to be trained that works in the facility, from food service to physicians, office staff, administrators. Everyone must be trained, and that would also be true with anyone that had access to the blockchain along its distribution network. The data stored also must be protected for 50 years after your death. So this means that there's a long-term storage need for the data, and it must remain protected and auditable for at least 50 years. It also prohibits the use of mathematically derived pseudonyms, also known as encryption hashes, to secure the data if they're based on protected health information. So you could not have a cryptography key based on your name and date of birth. You would have to have a cryptography key to indicate that this is your data based on something that falls outside of the scope of protected health information. There are a number of ways to do that, and some companies are actively working to devise strategies that are HIPAA compliant and use the blockchain to store protected health information. So those are some of the fundamental challenges facing the implementation of blockchain in the healthcare environment. Addressing these is essential to make sure that patient privacy and security is protected, and to allow the healthcare industry access to this technology that has potential great benefits to how data is managed and secured. Thank you for listening to this presentation. I hope you have a wonderful day.